So, in your opinion, what are the current challenges facing the healthcare industry in Asia?
I think the main challenges in Asia is to be able to access healthcare to all the communities because I think some of this healthcare are accessible only to urban communities. So one of the things that I think the technology can help is to be able to use the technology in telemedicine to be able to get medical facilities to rural areas and have access to specialists in you know rural areas from urban areas through telemedicine.
So, you think through IT technology, we can bring healthcare to more places in Asia that are in need of maybe facilities, clinics?
And specialist. Yeah, that's right. Yeah, yeah.
Okay, that's good. So, do you see any trends in Asia coming in the future?
Yes, after attending, some of the conferences here and also talking to people, I think they are very well aware of the technology and its capabilities that are being used in healthcare in the Western countries, and they are very optimistic about its potential in Asia. Especially Asia is still a little bit long to go in terms of adopting technology and having electronic medical records. So I had a presentation yesterday, and some of the questions that were asked is that the technology that you're talking about is very interesting and very, optimistic, but we are still, you know, in the not in the electronic age. We are still documenting stuff on the paper. So how can we do some of the things that you are saying? And so one of the examples that was given is that patients take a lot of different medications. So when a patient comes to a hospital, it is very difficult to find out what medicines they are taking because most of the medicines they are not aware of what they are taking. So technology in Western countries are able to kind of assess what medications they are taking because the pharmacies and the hospital systems are connected. So when a patient goes to a pharmacy to get the medications, that data is visible to a doctor. But the questions they asked me the questions about, we don't have that, so how can we do it? So I was telling that still we have to use the old technology in making calls to the pharmacy saying that this patient is what medicines they're taking, and also encouraging the patients to bring, um, you know, their medications in a package, history, and also bring the tablets, bring the strips with them when they come to the hospitals, and the doctors can look at it. And I was saying that everybody uses a smartphone. Maybe take a picture of the medication that you're taking, and bring it when you come to the hospitals, and show it to the doctors so that they'll be able to see what you're taking, because medication errors, the drug errors, are a major problem. So we don't want to prescribe medications that react with the medication that they are already taking at home. If the doctors don't know about it, then it'll be very difficult for them to prescribe the appropriate medications for them. So, so that is one of the challenge because of the lack of technology. So I think there's a lot of potential in the Asia because they have been talking about adopting some of those technologies that are used in the Western world. So it'll help a lot here in Asia as well by using some of those techniques.
So
Yeah.
this is definitely a trend that you see coming. Of course, we're learning from Western healthcare, which is more advanced. Um, so
Yeah, one of the advantages is that in West, we took a long time to mature some of those technologies, but in the Asia, we can literally take that and adopt it much faster. So it won't take that much of time. Exactly. We don't have to reinvent the wheel again. So whatever has worked in the Western, system can be immediately adopted here. So that's an advantage, even though it is late, but it'll catch up pretty quickly with the Western system. So, and with the internet, with the you know telehealth and things like that, it'll be possible to bring the specialists from Western countries to be able to consult patients here in the Asia without being physically here through the telemedicine. So I think that has got a great, great potential.
How are your objectives being met at this event? I just heard it's your first event, your first hospital management Asia. So how are your objectives being met?
I think it's a great experience for me to be able to talk to officials from different hospital systems in and around Asia, and trying to understand where they are and what system they use, where they are with technology. And I was, thinking in my own mind how I can help Asian hospitals in literally educating them of some of the things that we are doing in the West, and also helping them to chart a path to getting there step by step, one step at a time. So I'm really excited about the opportunities that I have in engaging, hospitals and physicians and technologists here in Asia, and bringing those technologies from the West to them to be able to start looking at those kind of things here.
So what do you like? What do you like the most about the event?
Uh, so far, the event was well arranged. I thought that the networking sessions were really good, and it was, in fact, the interesting thing about thing is that they literally used the technology in the HMA conference to be able to connect people, to be able to foster exchange of information. So which is phenomenal, and also to be able to see from different regions in Asia. It's not like one big country like the U.S. And each country is like India, Vietnam, Singapore. They are all in different levels, and it is great to see the exchange of information across those countries is phenomenal. So that is a highlight of my you know my experience in this conference. Yeah.
That's great. Thank you so much.